The House could vote on repealing and replacing Obamacare as soon as later today. Although we just heard from our producer, Chad Pergram, up on Capitol Hill, it is unclear if the vote will actually happen. Meanwhile, House Minority Leader Nancy Pelosi is warning Republicans that their vote, if they vote for it, it will permanently be with them like a tattoo. But remember back in 2010 when Mrs. Pelosi and President Obama were pitching their health care bill with these promises that turned out not to be true.
If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period.
Affordable. Good. Affordable. There's a reason. Affordable. 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 Affordable.
Well, it wasn't affordable. It was supposed to go down. It actually went up. And even back then, the headlines led us all to believe there was absolutely no way a health care bill was going to pass. So what is going to happen now? We're joined by Dr. Nicole Saphier. Okay, so unclear if they're going to vote today. But what do you make of what's going up on Capitol Hill right now?
Well, it's a bit crazy what's going on right now, and luckily tattoos aren't necessarily as permanent currently. We have laser techniques, so our legislators will get over this mess. You know, unfortunately, the Trump administration is dealing with the battle right now. Their altruism of trying to keep as many people covered as possible, also trying to be fiscally conservative, bringing down our deficit.
Sure, and I think that's one of the reasons why a number of folks who are conservative on the Republican side don't like Paul Ryan's suggestion because it does not bring the premium prices down for most people.
Right, and that's true, and so they're still trying to make some amendments. I'm really interested to see what's going to happen to the essential health benefits package. That's one thing that may change before our vote tonight.
Now, explain that, because apparently the White House started dangling that in front of a number of Republicans just last night.
Right, I mean, things are changing by the minute right now. Under the Affordable Care Act, the essential health benefits are essentially 10 requirements under each insurance premium, including maternity care, mental health, addiction, and so everyone's paying for these, whether they need these benefits or not.
You can be 60 years old and have to have maternity care.
Correct, and what they were trying to do is have everyone pay for a certain amount of things so that everyone is covered, but some people aren't happy with that. Why are they paying for someone else's benefits? It's not theirs. It was a weak attempt at socialized medicine.
Here's the thing about that. If they took that requirement out, that would save a lot of money. Your premiums would go down substantially. But then again, there are some who are in the House. They go, well, that will never pass the Senate. However, Mike Lee yesterday apparently said, you know, no one ever talked to the parliamentarian over at the Senate until we actually presented the bill in the House of Representatives. And she said, yeah, why don't you try?
You know, things are changing by the minute right now. It's kind of hard to keep track of everything that's going on, all these side conversations. It will decrease premiums for many people significantly, doing away with the essential health benefits. So I would be very interested to see if they put that amendment in tonight and the bill were to pass, how far they could go with that.
Okay, so we know that the folks who have to buy the Affordable Care Act insurance, it's been very expensive. The cost of the insurance is very high. The deductibles are very high. So they would like to see the premiums go down. But what about the healthcare industry? Do doctors generally want to see this go away? So the physicians, healthcare professionals, we truly want to help people. So the idea of everyone having quality coverage, as many people as possible, that is really our end goal. And we want to provide quality care to these people. Unfortunately, with the markets collapsing, we had a huge amount of people being insured immediately, and we just were ill-equipped. We were not prepared to do it. We need to support the medical industry, the healthcare industry. We need to make sure that we are able to care for all of these patients. And although the Affordable Care Act had some things in it that we need to be revised, whether it needs to be repealed and replaced or just changed, healthcare professionals are ready to work with the legislation to figure out how we can provide quality care. One of the things you were telling me in the break regarding the essential health benefits, those 10 things that everybody had to buy, whether or not they needed them, there are some who are objecting to get rid of that because of opioid addiction, right?
Right. So we were talking about that earlier, and, you know, our opioid epidemic is terrible right now. I mean, we have 1 in 5 people who are in chronic pain on opiates. Many of them will be addicted to heroin at some point, and many of them will actually suffer. So by doing away with some of the essential health benefits, a lot of these plans will no longer have mental health or addiction medicine. And that's a huge concern for a lot of groups right now, because we are in such a crisis mode that we need to make sure that these people do have the help they need.
All right, Doctor, thank you very much.
Thank you.
So once again, unclear if they're actually going to have a vote. We should know a little later on. Thank you.